Yeah, this is a new study looking at treatment with bispecific antibodies in patients with high-risk smoldering myeloma. These are patients that are at high risk of progression to overt myeloma. At about 50% per year, half the patients, would progress to symptomatic disease. So this is a high-risk population where there's no current approved therapy. So we're looking at these new immunotherapies that have been approved for patients with relapsed refractory myeloma and seeing if we can safely bring them early to prevent development of disease. So this is a randomized trial with the control arm of Lenalidomide and Dexamethasone, and we reported our first results of the first 12 patients. And these patients, again, are high-risk smoldering myeloma patients. Many of them had disease markers that were increasing right before study enrollment, meaning that they were at risk of imminent organ damage. And this was the first trial looking at these bispecific antibodies in this population. And it demonstrated that 100% of these patients responded to therapy. And not only did they respond, they had very deep responses. So 100% of patients achieved MRD negativity on this trial so far to date. And the good news is the safety profile seems to be more favorable than what we see in patients with relapsed refractory myeloma, with less cytokine release syndrome and also less infections to date.